Welcome to Security Heroes, a podcast by Athena Security. We share real-life stories to help connect you to real heroes in the security world. I am your host, Lisa Falzone. Warning, the following recording contains potentially disturbing content. Listener discretion advised. Joining us today is John Oast, Director of Security Training and Special Programs at Geisinger Health. John has spent a quarter of a century in law enforcement and healthcare security, from working as command staff in the Richmond Sheriff's Office in Virginia to serving as an instructor with both American Red Cross and the Virginia Department of Criminal Justice Services to managing and upgrading security operations for Geisinger Health. He is a certified healthcare protection administrator and recently joined the board of directors at IAHSS. John, pleasure to have you here.
Thank you, Lisa. It's an honor to be here.
So what inspired you to make the jump from sheriff's office to healthcare?
Probably similar to a lot of the others that are in the industry. So at the time, ironically, I had seen myself as a career law enforcement officer. I'd first gotten into it in Virginia back in the late 90s. In 2009, my wife was offered a position at a university in Pennsylvania, which basically changed the location of our family. And we were kind of talking offline. I fished professionally on the side, and we realized that professional fishing wouldn't pay all the bills. So get off the couch when you're at home and get a job. I started working as a part-time officer for Geisinger. Just part-time on shift, just to make a couple extra dollars. They learned of my background primarily with gang investigation and fraud work. I was in that role for about 6 months before I became a site supervisor, and then it kind of went from there. And then I kind of just fell in love with the industry because I'd grown up really with two parents that had been quite ill through my childhood, and worked with the Red Cross and done a lot of stuff and taught a lot of EMS related training. And it just kind of came full circle. And I'm still here, whatever it is, like close to 15 years later.
Nice. You said that in spite of previously being a cop and an instructor, working in healthcare security is the toughest job you've ever had. Why is that?
Because there's a lot of the regulatory requirements that we're dealing with. I kind of think it's interesting when we have the conversation, especially in the IHSS chapter meetings. The roundtable discussions are just amazing, realizing that we're not the only ones experiencing it. For instance, this week, going through some incident reviews with our Department of Health related to our magnetometers at our campuses, looking at workplace violence regulations. I talk with our new supervisors and managers when they get promoted or we hire them on, that it's a unique environment because you have multiple chains of command. Your audience is, your internal customers and your external customers, being the employees and those that are patients and visitors, but you're reporting up basically through clinical and administrative staff plus your chain of command within our department. That with regulatory requirements, be it paperwork and reporting out, it's a lot. It's a lot that a lot of local, especially municipal law enforcement, may not, have the responsibility of doing. And I enjoy the statistical side of it and the analytical side of it, so I kind of enjoy it, which is kind of disturbing. But that's really the why this is so challenging. We've had staff that's made news nationally. We've had a staff member fairly recently was stabbed at work. We've had homicides on our campuses, things of that nature. And it's unique. It's a totally unique role that law enforcement really transitions well into it. But there's that whole other regulatory side that is typically new to that role.
And you guys just got acquired, right?
Right. We're in a unique situation. We are now part of the Kaiser Permanente family. But what they have done, they've created a branch off of Kaiser, which is Geisinger Health, which is essentially some of your larger regional essentially rural health networks. So our CEO from Geisinger is now has been made the CEO for Richmond Health, which is based out of the Beltway area down in DC area. So we're under Kaiser and we're kind of separate from Kaiser. So it's a unique model under their business plan.
What's the new branch called? Verizon Health?
Risant Health with
Right.
Risant Health. Cone Health is now part of it out of the Carolinas. That's fairly a new thing. So we're basically Kaiser, but we're working with Kaiser closely with them, but we're kind of a separate entity. So not necessarily within their reporting structure at this time. We go through that Risant structure.
So you're not like consolidating or anything like that.
Yeah, we still got Geisinger and all of our signs. Nothing's really changed essentially, and we don't plan for it to.
Got it. Okay. How do you view your role running security at Geisinger? What are the things you're focused on these days?
I think like everybody else right now, it's workplace violence. That is the big ticket item. Unfortunately, a couple of weeks back, we're all familiar with the incident that happened just a couple counties over from where I'm sitting now in York with an active shooter on campus. Everything from day-to-day violence perpetrated against our employees or patients, even patient-on-patient violence. There was one this morning, employee-on-employee violence. We've seen it, at least within our organization, that the numbers, the statistics have actually gone down over the last year or so, but it's still significantly higher, not just with us, but industry-wide, basically since 2020. After COVID, you really saw that trending going up. So pretty much every day, I spend my day, first thing I do when I have some downtime, pull a lot of our incident reports. I'm pulling our Clery incidents and our UCR incidents around the system and pulling them all in and looking at different type of incidents and essentially tracking all that workplace violence. We're a joint commission accredited organization. So we have those standards that were added in 2022 that we're achieving those benchmarks with Joint Commission, but now it kind of gives us more oomph behind it, basically, to get our staff to report and document more. So really, a lot of it is the analytical and statistical side of workplace violence. And then one of the things we've recently done similar to it, within the last couple of weeks, we have established a sworn law enforcement entity within our public safety department here too. So we have sworn police officers that work for Geisinger. That's most of my job is around the workplace violence side of it.
Yeah. What happened? Can you talk about what specifically happened this morning that you had to deal with?
So one of the things we've been working with lately, we did have a couple, you may have seen again in the news recently, where we had one of our officers that had been stabbed, unfortunately, got cut pretty bad. What we've been doing most recently since then is just trying to evaluate our weapons detection programs across the system. That's really been what we've been spending a lot of our time on now, and then working with some of our surveyors and seeing how we can improve the process. That's really what it's been the last couple of days. A lot of follow-up. I know we also had an ISS SIG group a little while ago on weapons detection, and we discussed a little bit of it, and I told them a couple of stories there. But looking at the regulations and the requirements, Pennsylvania doesn't have as much of the regulatory requirement of visitor control and weapons detection as we have in a lot of other states or in other countries, even possibly. So it's really kind of setting the standard. And again, you're looking at these other healthcare systems across the state. When you get outside of those urban areas, you don't have it. So that's really kind of what our discussion has been the last week. A lot of it started, of course, we've been working with the workplace violence, trying to go through statistics. We created our own dashboard. When we had the CEO homicide a couple of months back, everything kind of ramped up on executive protection and violence on that end towards executives and providers. And then when the incident happened in York, it's transitioned back again to the active shooter situation. And about the same time when we had our incident happen with our officer that same week. So that's kind of come around back to the active shooter concerns. And we also, unfortunately, a couple of years back, did have an active shooter and a homicide where one of our employees in one of our hospitals was killed. That same year, we had another individual just happened to be in our parking lot that was killed. walking through one of our properties, was killed in basically a high school fight.
Jeez.
Yeah, so we've seen it, and the active shooter part, and the more the weapons detection. We still have been working towards improving our weapons detection and magnetometers and so forth. But since York, it's kind of bubbled back up to the top, I guess you could say. Yeah.
So did the knife get through the weapon detection?
We are not 100% sure. We're still looking into it. The person had been here for a few days, so it's a good chance that it was just introduced to the environment and wouldn't have gotten through. The individual, to my knowledge, also didn't go through that through screening at the door either.
Mm-hmm.
We had a conversation this morning on that SIG group discussing what if somebody comes via EMS or as comes in as a direct admit or something, or comes in through the front door and you're running weapons detection at your EDs only or at certain entrances. Yeah, so that was kind of there was some complexities in that. So we're not 100% sure.
Yeah, I'm just curious how big the knife was.
Very small folding knife, but it didn't take much to do much damage.
Like how many inches?
Half inch.
A half-inch knife?
Yeah, half-inch blade.
Well, I've heard you say that it's a problem that frontline workers often don't know everything the security department does, like workplace violence committees and tracking and reporting. And how do you get the word out to let them know?
We are very lucky. Our executives at Geisinger have been very supportive of our department. My primary role is a lot of the outreach, training, education, speaking to groups, but I work very closely with a gentleman, Mark Allred. Mark is an RN. He's a registered nurse. He's also comes from a background where he was Marine Corps, and he has a criminal justice degree. Gentleman's from Michigan, and his job is to work as a security nursing liaison. So he reports to security, but he also gets out in the nursing community and goes to meetings for nursing and clinical staff, helps us get the word out. So between the two of us, we're doing a lot of trainings, a lot of meetings, and rounding as much as we can.
Yeah, you seem very, very, very busy. So
It's job security.
yeah. So recently, you've been leading the charge to shift security at Geisinger to sworn law enforcement. Why has that been so important to you?
It's a big one. We had been looking into it for a number of years. The Commonwealth of Pennsylvania is one of the states that will allow nonprofit organizations to have sworn law enforcement. It's what's called Act 501. And there's a lot of states and countries may not authorize private employees to be sworn. Commonwealth of Pennsylvania still allows that. Similar to a lot of our nonprofit private universities, they fill that role. That's how they're allowed to be sworn. So we had our active shooter incident a couple of years ago at our main campus in Danville. That, along with some of the other incidents we've had, and just looking at numbers for how many weapons come onto property. Pennsylvania is interesting. You have the Philadelphia and Pittsburgh communities. Between the two, there's some jokes that float around the internet. You might have heard about Pennsylvania, Philadelphia, and Pittsburgh with, I'm not going to say it's some areas in between. We're most that in between areas. So there's a lot of concealed weapons here, a lot of carry permits, a lot of weaponry. For instance, in this area here, first day of hunting season, everything's closed. Yeah, schools are closed and everything. So there's a lot of firearms. So just to respond to any potential threat, that's why we went that route. We basically weighed having unsworn armed security versus sworn armed law enforcement. So the cohort that we have as sworn officers, we have only 13 of us right now, but we're scattered throughout the system. All of us have previous or current law enforcement experience. We've all been certified municipal or state law enforcement officers. So we're kind of looking into it as a way to give us those additional tools and also assist when we need the municipal law enforcement to respond. So where there is a backup to them, but also to have those tools in case something, knock on wood, really escalates on our property.
Yeah, you mentioned reporting and analytics in your job, and then you like the data. What kind of data are you looking at a day-to-day basis?
That's a good question. We are leveraging multiple data sources. So we the dashboard. So we are pulling our security RMS data and we are comparing that data to our patient safety report management system, which we utilize Midas. So we are able to compare workplace violence incidents because we have all of our incident reports in our reporting system marked as a yes or no to workplace violence. Plus, if they fit certain thresholds into our Midas system, they are tracking it also. So we know there's multiple sources of truth. We basically have an overlay looking at the two to make sure the trendings are going accurate, because we have incidents that get into Midas but not security and vice versa. So we're looking at that, but we also have some other sections of our dashboard where we're pulling in workers' compensation data for workplace injuries for staff related to workplace violence, and leveraging some other factors related to that report management system. So we're leveraging things, say, from employee health, security, patient safety, and workers' compensation, and throwing it all into there. We can pull different and compare different analytics.
Yeah, so I know Geisinger is in a unique situation with all the correctional facility escorted visits. Can you talk a little bit about that and what extra precautions or measures do you have in place to handle that?
Yeah, we are surrounded by local, state, and federal. We have some of the largest federal correctional institutions in the country here. We're in our footprint is interesting too, because right now I'm only maybe 45 minutes west of the Water Gap. So I'm a straight shot on 80 from New York City, straight up the northeast extension of the Turnpike from Philly. So there are a lot of correctional facilities here. We at some of our campuses in the past, so we've seen several hundred inmates come through our doors in individual campuses within a month time frame. So whenever and I'm sure other organizations do it kind of similarly, we just do it on a very large scale. Whenever a correctional facility is inbound to our facility, they contact our security dispatch office to make sure they have a parking location and location where they can unload, come in, and find a nice quiet location to be within, say, the ED or whatever clinic they're going to. We'll greet them at the door. We'll escort them from that point to the location. We usually go with them until they check in, and then we're on standby. If they need us, we come back. But then once they're ready to be transported from one location to another, if they're admitted or when they get discharged or leave, we greet them and escort them back out. We also have orientation brochures that go through all of our life safety measures and a lot of our requirements and phone numbers and everything else. We hand those to each of the correctional officers. They already don't have it in their post orders. We get a sign in. There were some regulations in Joint Commission that fell under the Human Resources chapter, in which healthcare organizations were charged with orienting forensic officers. That kind of the wording of that's been changed a little bit over the last few years. We're still going through that, but we keep a log of where every inmate is. If I was to go to our main campus in Danville right now, I bet you there's probably a dozen inmates that are inpatients right now. We do a lot. We've done as many as 500 escorts within a month before, just at our main campus.
Have they ever caused a violent incident?
Unfortunately, the first homicide we ever had on our campus that I know of, unless something happened 100 years ago, was back in the late 80s. There was an inmate from Lewisburg Federal Penitentiary. That's a facility where the original term, the big house, came from. Like Al Capone was there, a lot of mafia people through the 1900s. This gentleman had got word out to the outside that he was on his way to the hospital. He had some friends of his, I believe he was from Philly, a mafia related guy. Were outside our ED with weapons, got into a shootout. A federal correctional officer was killed. They got into a white van, got about 15 miles down the road before they were caught. But that was right outside our ED. The biggest thing, knock on wood, that we've seen now is them just trying to secrete and introduce things into the prisons from their visits to the hospital. I mean, they're coming here for everything like dialysis and weekly and sometimes more often treatment than that. So we've seen a few things, but that was the one pretty bad incident we've seen.
Wow. What's the most important thing that hospitals need to address in their staff training?
There's a lot. For instance, Joint Commission now requires annual workplace violence training for all staff.
Mm-hmm.
I think what really needs to be said is what level of training.
Mm-hmm.
A lot of us, a lot of organizations have the bare bones minimum, check that box off. But I really think that we really need to evaluate the staff, look at what type of work role they're in, what their environment they work in, and train them accordingly. So I think just basically giving them the tools. Last year, we did an active shooter exercise at every one of our 9 hospital campuses and at all of our outpatient surgery centers and some of our larger clinics too. So everything from active shooter training to physical and verbal de-escalation training, but a lot based upon a role, and educating them on what tools you have, what resources you have. For instance, when Mark and I go out and speak to groups, like you had mentioned, a lot of our staff, they don't know what they don't know. They don't realize that the organization, for instance, us, we have an anonymous reporting portal. They can go into our security SharePoint site. They can submit an incident report. It's going to pop up on our notifications for anything. So just knowing that we are there to help them and giving them the tools that they might happen to need. I think that's probably the big thing. Training, prepare your staff.
Yeah, I mean, your technology and your systems are only as good as, the training that people get. So in conclusion, I mean, like, what's your vision for physical security industry in hospitals?
Looking at, although there are budgetary constraints,
Yeah.
a lot of it comes back to FTE. So I know we've got a lot of FTE, employee budgetary restraints, being able to leverage the technology end of it.
Mm-hmm.
Now, since we've had multiple shootings, again, as recently as today in healthcare facilities, it's only a matter of time, unfortunately, and we've experienced it on our own. Now, the weapons technology might not have identified it because it happened in a parking lot for our purposes. But being able to identify those threats before it actually goes sideways, utilizing camera systems that have some type of AI embedded technology in it. We utilize facial recognition, having weapons detections at the entrance, access control systems. I know it's a big challenge, especially with some of our smaller health systems around the country where they may not have the budgets for that. But when you're trying to crunch numbers and make ends meet, you've got to look at the different resources you have. And basically put a bubble around your facility and identify who's walking in those doors at any time. And then, you're minimizing the hazard.
Awesome. Well, this has been really fun and very informative. So thank you so much, John. You were really fun to talk to. So thank you.
Thank you. It's a pleasure.
Security Heroes is brought to you by Athena Security. To find out more about Athena Security and how we help save lives through our weapon detection solution, visit www.athena-security.com. And then make sure to search for Security Heroes in Apple Podcasts, Spotify, and Google Podcasts, or anywhere else podcasts are found. Make sure to click subscribe so you don't miss any future episodes. On behalf of the team here at Athena, thanks for listening.